So I'm going to give an overview of what the recent discoveries of my lab have been. In the past few years, I moved to UT Southwestern 2 years ago, so it's pretty much like recent stuff. So the key points are going to be kind of like a multi-patient study on structures of fibrils using cryo-electron microscopy, and also the development of clinical tools using structures for both diagnostics and therapeutics. We've been working on amyloid fibrils for the past couple of years using cryo-electron microscopy, and using that information, what we've seen is that fibrils from patients can be really different from each other. The same patient can have different fibrils, different genotypes can be associated with different fibrils. The same genotype can be associated with different fibril types. So this is something of a nice discovery for us. I'm a structural biologist by training, so this is what I love the most. And then also we've used those structures to develop peptides, and these peptides can be used either for stopping aggregation of ATTR or also for detecting aggregation of TTR. And we've done that. We've tested these peptides in multiple systems, and we've also gone from ex vivo fibrils and testing with ex vivo fibrils, and also with blood samples, and we can detect ATTR aggregates in blood of patients, which is very exciting. Currently in the field, there's not many or none specific biomarkers for ATTR. There are biomarkers for cardiac, cardiac failure, cardiac impairment, or things that are more like not specific to amyloid itself, which is at the end of the day the cause of the disease. So what we've been targeting in the past year is exactly that. We want to be able to detect aggregates of transthyretin, not like indirect measurements or even like concentration of transthyretin. Sometimes it's not even related to progression of disease or to even like effect of treatment, but aggregates itself. So we developed these peptides that can bind to aggregates of transthyretin, and they can do it using biopsies, blood samples, or pure fibrils, and they are not binding to monomer of transthyretin, they're not binding to dimers, they're not binding to tetramers, they just recognize aggregates. And we are able to detect aggregates in blood of patients, and these aggregates go away after treatment with stabilizers or gene silencers, which is also quite of a discovery. So we believe that with these peptides, we're going to be able to either both diagnose early and also just track progression, monitor progression of disease with or without treatment, and maybe use it as a measurement of prognosis.